health response. So we'll just get started. Welcome. Kia ora tātou. No mai haere mai ko Amy Richardson tōku ingoa. Thank you and welcome to our special report inside Save the Children's Health Response in Cox's Bazar. My name is Amy Richardson, Save the Children's New Zealand's Communications Director, and I'm very proud to be facilitating tonight's webinar. I'd like to start with a very special welcome to our guests and team on the ground in Cox's Bazar. Save the Children Area Director Maheen Chowdhury, alongside Doctors Abdullah Al-Noman and Tanjita Bashanti. I'm also delighted to welcome our own International Programs Director, Rachel Waugh. And a special ngā mihi nui and thank you to you all for joining us here this evening. Please let us know where you've come from tonight. Plug it into the chat. You'll find that at the bottom of your screen. And I'll be monitoring that chat and also the Q&A function, which should also be at the bottom of your screen during the webinar. So if I'm looking off to the side or I look a little distracted, that's what I'm up to, just getting your questions. So feel free to put those questions into the Q&A or into the chat along the way, and we'll get them answered for you. I'd like to take a moment to thank you, to thank everyone who has already given to the fundraising appeal that we sent out earlier in the year to support this health response that we're talking about tonight. And if you haven't donated already, or if you'd like to help further, you'll find a link to help support this vital work in the chat that Kat's going to put into the chat now. And thanks to the generous support of the New Zealand government, your donation will be matched dollar for dollar. We'll start now tonight with a video that the team in Cox's Bazar has put together just in the last few days to give us all an idea of what it's like on the ground in these health posts. Kat, if you'd like to play that, that'd be great.
Welcome to the Save the Children Health Post. Save the Children Health Post are providing comprehensive and integrated health service for Rohingya and adjacent hosts. Now we are entering into the health post where in entrance there are hand washing stations, both for adult, child and reachable for person with disability. In the outpatient department, we are providing curative service for 6 days in a week. When a program participant came to the facility, first he or she go through the primary screening. In this primary screening point, there we do segregation for general patient from flu-like symptoms, separate for flu corner and for sentinel testing and further referral. Then they came to the triage area where we prioritize the cases according to the severity. Here we are providing red, yellow and green card. As well, our maternal child health nutrition assistant promoting health education in the triage area. After then, depending on the triage card, program participant go to the registration point where we documented all the individual information for identification. Then program participant need to wait there for measuring their vital sign. After measuring his vital sign through a medical assistant, including non-communicable disease screening like diabetes, hypertension. Next, program participant go to the doctor's room. There a doctor do their physical examination and prescribe for treatment plan. Here all the services are free of cost. Another integration of the health service is mental health and psychosocial support, where one psychosocial support officer provides psychological first aid. Being a fixed vaccination center, Save the Children are supporting Bangladesh government in expanded program on immunization, where we achieve a good vaccination coverage, especially during COVID-19 vaccination campaign. In addition, Save the Children providing outreach initiative for preventive care through community health workers who are engaged in regular community-based awareness, sensitization, referral, and promoting health education through door-to-door household visit.
Thank you so much, Kat, for playing that. And thanks to the team for giving us that insight. It really gives a sense of what it's like day to day. But I'll turn to you, Maheen, and ask, we'd like to hear a bit more about what it's like for the Rohingya refugee communities living inside these camps in Cox's Bazar. What are some of the greatest needs that children and their families are facing? Maheen, you're on mute.
Yeah, thank you, Amy. Thank you all for your attention and support towards the Rohingya refugees. So, as you have just seen a help post, the Rohingya community are entirely dependent on aid, from health to food to education, for child protection services, for liquid petroleum gases, for as cooking fuel, and so each and everything are coming through aid. And it is around 1 p.m. in Bangladesh time. So if I say to the camp life, like hundreds and thousands of children, actually they have completed their lessons in the learning centers by now. They completed the first shift, and another 100,000 are waiting to start in the second shift. Help post, you have just I have seen one help post. We have around 100 of them in the camps for. And they already consulted around 100 patients and passing very busy time. Passing busy time. Couple of grants, around 20,000. They received food already, and like it's a very busy working hour at this moment. But overall, camp life is not pleasant, not a comfortable, and is not secure either, particularly for the refugees. And you will see that staying and living in a highly congested area of having around 35,000 individuals in per square kilometer, which makes the camp most congested area. And for a family up to 6 members, only 150 square feet of bamboo and tarpaulin made shelters under the sun and extreme heat right at this moment, in a hilly terrain, with risk of fire, with risk of landslides, with risk of security issues. The vulnerability actually huge. And half of the population, we have around billion, are children. So oftentimes we refer this crisis as children crisis. Oftentimes we refer this crisis as protection crisis, because both children and protection issues are the most imminent issues we have here. We need to ensure basic services day by day, month by month. We also need to keep this huge population safe and secure. However, the vulnerability increases by many-fold with other factors, like, as I already mentioned, the security issues, funding issues. Right, for example, right at this moment, we are communicating with our participants the upcoming further ration card from $10 to $8, which will start from 1st of June, and that will be a huge that will have huge impact, because already with $10 per person per month allocation, they are under the minimum threshold of 2,100 kilocalorie per person in food intake, and it impacts everything, like LPG, the fuel, cooking fuel, the wash supplies, access to education services, and increasing vulnerability to the protection concerns like abuse, child marriage, child labor. So lives are related to every vulnerabilities, and children are more exposed to all sort of things, including trafficking, including abused by family members, neighbors, negligence, not having enough access to education services, and particularly adolescent girls who have very strict mobility in the camp due to the conservativeness. Literally, you will not see any adolescents outside, adolescent girls outside their houses, and they stay in this small shelter without having any exposure to outside. So this is the life, and the humanitarian workers like Save the Children and other international, national, and local organizations, including UN. We are trying our best to minimize the vulnerability, to support with what we have by providing basic services, by providing protections, and with the camp authorities, including law enforcing agencies, as much as possible. But you have seen in many times that there are also risks and there are also incidents that actually the protection issues are coming from the authorities. And that's all. But would like to hear if you have any question or comments. Overall, camping life is very difficult and unpredictable without having any durable solutions in near future. So it's like we don't know what will be the end. We are trying to live and to support day by day. And we are extremely grateful to our supporters across the world, like you from New Zealand, who are supporting a lot, and that support actually keeps us to move on, keeps us to continue our support with risk, with so much challenges, and life goes on here with that support. Thank you very much. Over to you, Amy.
Thank you so much, Maheen. What an insight into just how great this need is. And I'd like to really acknowledge the work of you and your team. It must be incredibly hard to keep morale up in these sorts of situations. So we will talk about that later. Now, please, everyone who's listening, feel free to put your questions into the Q&A box and we'll get those answered for you. Dr. Noman, we'll turn to you now, just to talk about the actual health response itself, the health posts, the conditions of those, and what a typical day might look like for you. What are some of the issues for children and their families that you're seeing day to day?
Thank you, Amy. Thank you so much. So, hi everyone. This is Dr. Noman. I'm working as a senior manager in Cox's Bazar office and leading the health and nutrition program in Cox's Bazar Rohingya Response and the host community. So, as you have already seen, that the brief of our health post how we are working here. Actually, Save the Children is currently operating in the 7 health posts and 27 primary healthcare centers in the different Rohingya camps located in the Cox's Bazar. So under the New Zealand funding, currently, we are operating 2 health posts in 2 campuses. And as we have mentioned, Maheen Bhai has said in his statement as well, working in the camp settings is and will always remain challenging, especially for the healthcare workers who are directly involved in the healthcare provision to the vulnerable populations. So as we have seen that our health post is made of the bamboo structures, the infrastructure is a bit low, and as you know, under the direction of the government, we have to make our the infrastructure within the minimum premises. And currently, in Bangladesh, we're going the extreme heat event, and we are going through a heat wave. So this is how this is making very exhausted our healthcare providers who are currently working in the health camp settings. Every day, they're experiencing around 39 to 40 degrees Celsius of temperature. So as you've seen that electricity is not available in the health post level, we have to depend on the solar panel system. So this is how the fans, the lights, this is a kind of challenge, and this is how it's impacting our service delivery. And because of the heat and the temperature, you know that the the health program is the fully dependent on the medicines, pharmaceuticals, supplies, and you know that most of the supplies has to maintain the optimum temperature. So because of the heat, sometimes it's very difficult to maintain the optimum temperatures of the medicines. And this is how actually the quality of the, sometimes we experience that the quality of the medicines also downfall. And besides that, actually, you have maybe seen that throughout the different articles and the statement for the, this is the fifth, 6th year of the response, and throughout this year, actually, have gone through the several outbreaks. And in recent, actually, we have seen that there was outbreak of the scabies, the skin diseases, and that the AWD and dengue was another factor. So in such kind of actual outbreak, you know that we sometimes faces the unavailability of the medicines and the supplies, because our the medicines and supplies actually depends on the disease trend, and this is how actually we procure. So this is the kind of the issues actually sometimes our staffs and the health service actually face. And you see that the health premises actually the staffs who are providing the services, you know that the beneficiaries comes to us with the different diseases, and the physicians, they diagnose the diseases, and sometimes you know that the health post actually this provides the minimum package that was guided by the Ministry of Health and the Health Sector Cox's Bazar. So health post doesn't have all the facilities available, where actually we have to depend on the primary healthcare center, which actually continues on the 24/7. So sometimes actually faces the difficulties on the referral system to refer the patient the 24/7 centers. Even sometimes they don't have the adequate facilities. So this is the kind of some challenges that actually our the staffs are facing. And along with that, you know, if we talk about the beneficiaries and our staffs, you know that every day actually the expectations from the patients is getting high. As you will know that the Save Sicilian is trying to provide a quality essential health services to the beneficiaries. So sometimes actually the demands that to receive the medicines, high number of the medicines. As you know that we provide the guidelines and we provide the medicine in such cases. And even in the peak hour, actually you see the crowd in the in the our trial system, where actually sometimes it's very difficult to maintain the crowd control. But however, we have the facility volunteer. We try to maintain the crowd control systems. And even another challenge is that actually they don't have the tendency to bring their previous prescription card. So this is actually very difficult to monitor their the cards, their previous history. So our health promoters who are currently working in the health post, they are doing the sessions in front of the triage, and they're delivering the health messages, informations that they have to do while coming to the health post. Even we have the robust community healthcare workers. They are also going to the household, and they're doing the visits and meets the influential person. They're also supporting this such way. Another thing also mentioned by that actually the camp situation is day to day is getting very vulnerable. Actually, as we are observing, that the camp situation is getting very vulnerable from the end of the last year, 2022. We are observing the gunfight, armed conflict is happening a bit periodically in the camp settings. So, and actually this increased attention among the health staffs who are currently working in the health post level. Even this affects their mental health as well. So how actually are mitigating these issues? You know that Save the Children Cox's Bazar office, that we have a dedicated safety security focal where actually the safety security focal provides the advisory to the all the staffs. Even we in the respective camps, we have our dedicated camp focals, so which actually the messages are disseminating to our camp staffs. And we have also the mental health wing, where actually our advisor, the advisor does the periodical the session with all the staffs to maintain their well-being. You know that the children's and their mothers, they are the most vulnerable population in the camp settings. As you have seen that we are providing the vaccination center, and vaccination dropout is a kind of issues that we are facing. though we are achieving a good number of coverage. And now we have also seen the issues of the pregnancy related cares and the care after the pregnancy. So these are the some issues that we are receiving from the children and their parents, and our skilled workers and the community healthcare workers. They're doing the repeated follow-up in the community level to cover the dropout and to cover the gap of the antenatal cares and the postnatal cares in the settings. So this is actually how our staffs and beneficiaries they are working tirelessly in the camp settings to and the issues that mitigating. Thank you.
Just incredible work, Dr. Noman. And there are a couple of questions that have come in, which we'll get to at the end, but it is definitely around that how you sustain that momentum in your staff and keep the morale up, because I imagine that in those conditions it must just be really tough, and I mean, understatement, but gosh, I mean, you're just so committed, and it's amazing to hear about. You mentioned the maternal services and the sexual and reproductive health. So I'll turn to Dr. Bashanti, but before we do, we're just going to see a little vlog that Dr. Bashanti actually did for us just before the webinar, so that we can get a sense of what it's like in the health posts, and she's going to take us around. So thank you.
Hello, this is Dr. Tanzida Bashanti, working as a manager, sexual and reproductive health, Rohingya response, Save the Children. Right now, we are standing in front of Camp 20 health posts. So here is our service charter. It's a sexual and reproductive health service also present. One reproductive health room, another one is IYCFE corner. And right now session is menstrual health hygiene. These all are short-acting reversible method. In this center, we provide only short-acting reversible method to our program participants. Maximum for obviously female acceptance and one for male program participants. So inclusive, it comes with adolescent service, it comes with other components like disability inclusion and gender diversified populations also included with their proper dignities and confidentialities. So these all are developed our sexual and reproductive health service, where we can provide from the pregnancy period, even though the preconception period, pregnancy period, maternal care, along with postnatal care and family planning, symptomatic management of STI, as well as CMR service, that is clinical management of rape and intimate partner violence service. And as well as we have our community health worker team, those really active for disseminating reproductive health knowledge, maternal and neonatal health knowledge, for the sustainability of reproductive health right in emergencies. This is very effective, and Save the Children always targeted do no harm policy, that we can provide best care for our program participants. Thank you.
Thank you so much. It gives us a real, it's amazing to be able to actually see inside the work that you're doing and the places that you work. So Dr. Noman mentioned some of the particular vulnerabilities around this population, but Dr. Bashanti, can you talk to us about some of these particular risks facing women's maternal health in the camps and the challenges that you're seeing, and how we address these issues through the response?
Thank you so much for allowing me. So right now we are talking regarding maternal health issues or sexual and reproductive health issues in the camp setting. We are right now in 5 years of response. So there is still challenge ongoing, and I can address from antenatal period to uh, like this way. We provide antenatal period in these sectors with focused ANC visit, that is 4 ANC visit component. Here there we faces that the dropout, I mean the last trimester visit, that could be still in a negligence way, even though the in camp setting populations. So we are counting 4 care, but that is a matter that even the 4 care is finished before the 3rd trimester or the last trimester. So when we talk regarding the health post, we know that health post is daily basis service. So we are offering selective of services. There is we cannot do uh, uh, delivery services, facility deliveries, but we promote facility deliveries we through the messaging health educations. But in some cases we observe that still home delivery practicing through them. Therefore, I can share the story regarding such cases. In last month, we observed that one mother came to us immediate after delivery, retained abdomen, uh, complications arise immediate after delivery, severe pain and temperature. And we when we take history and everything, that we saw that she already received 3 cares from us. But when we suggested that delivery to the PSCC, nearest PSCC of them, but she did her husband didn't allow, so she delivered through the home. After that complication arise, she and her husband feel this is the safe place, I have to come here. And that time we try to refer that case, we arrange everything, but as a male dominating society, husband and the father-in-law both are disagreed. So these complications is just a case story, but it's ongoing process through them. And we right now, I already said that we are so many years in here, but still there is need of family planning because of their high fertility rate. We all knows about these things, and all comes through that it should be done by women ultimately. Even though the family planning choices, I already explained that all are depend upon the male partner who decided to take female, that she received or not. Even that's why the acceptance rate of long acting reversible method, this is also uh, low in camp context. Even though they received long acting reversible method, but they removed also because of their norms, practice, and some of stigma they believe. Interestingly, they believe this is the foreign particle, if I take into the body, I cannot if I die, my body, it cannot be proper funeral process, through the proper funeral process. So it's a myth, it's a story, I know, but this is the real scenario they believe, and we are working on them. Therefore they deprived from their reproductive health right, family planning right, they gone through high rate of post abortion care. Ultimately after that we are working to increase their acceptance level through our CHW working groups. Even though some of our sectoral level involvement, you know that when we talk about reproductive health, we have to coordinated, collaborated with SRH working group in every sectors. In here there is a also with seek support, even though from the Bangladesh government level, they also involved for advocacies level. There are so many misconception regarding religious theme. So we work on Islamic foundation to eradicate it or to improve their belief in a right way, not in a wrong way directions. And yes, right now, slowly, but it's acceptance through them. And those who acceptance, we try to catch them, we try to make our advocate to them. Yes, you can role model to your society, and you can inner pace or faith for your community, for your nearest one, who can believe that this is the method, this is the service for your right. Same as I can see that the uh, also a blood donor and the transfusion, because for the delivery facility delivery, in some cases we need to refer if complication arise that to the higher facilities. CMOC center, CMOC center is very few for this in these sectors. So there is a need for center for minimizing complications, center for where they can uh, easily avail the blood donor or the transfusion facilities. So another thing I would like to address that maternal mortality rate. Here is maternal mortality rate in last 4 months. It is reported only 66. That is only reported, and other lots of case that is not reported who are home delivered. So what about these things? Even though those are reported after when we done perinatal maternal and perinatal mortality survey team, we are working on, we can find out some of their gap of meaningful ANC visit and their counselings, proper referral through the higher facilities, how case should be stabilized, this is, and the transportations also are another things, challenges for this mother. And lastly, I would like to address the referral setup that yes, in here our Bangladesh government supported uh, Teknaf, one point, and another is Ukhia zone. There is two Shodar hospital, but there is also some kind of challenge still in here. We need to work, right? If I cannot find the skilled manpower in this center, then I have to refer to the tertiary level. After the tertiary level, this tertiary level highly volumized with referral patient, refugee population as well as the local host populations. Even though there would be a referral center which is run through UN, IOM, and UNHCR. Right now, there is a cross shrinkage or cost minimizing effectiveness. This is also a gap because they maintain very well coordinated way, but somehow it's ongoing. So this is also challenge. And another thing I would like to mention, that's gender diversified populations and disability inclusions. We know that we try to include, but here still need lots of sensitization, lots of work. So right now I can accumulate these all my experiences, and I know that's when we talk, there is so many needs generated, so many issues coming through. If I can overall sum up in a one sentence, I would like to say that everything what we do, all are depend upon funding, budgeting. That's all the meaning of sustainability. We are all are in here, we talk regarding issues, problems, everything, and we address these things. But what if, like, New Zealand support us very first period of this response, if it should not happen in future, then our health post should be closed. And what would be, there is no health post, no service, no sustainability, no reproductive health. This is the issues. So we need to focus on these areas. And as well as right now, yes, we are trying to minimizing our level and try to advocate, try to capacitate our own staff as well as the volunteer as for the dignifying service. Even though the community health activities is merging enough, and these all are our thoughts. And if any kind of questions is there, I would like to appreciate to answer. Thank you.
Thank you so much, Dr. Prashanti, and that's absolutely right. Without this kind of crucial funding, this wouldn't be, and I imagine that things would be even, so much worse. I think a couple of the questions that have come through, and one that I actually had on my list too, Maheen, is around these a prolonged crisis such as this. What a huge toll it must take on the team, and each of your team members have talked a bit about that. So what are some of the biggest challenges for the team, and how do you keep staff morale up in this situation?
Okay, thanks, Amy. Like, what keeps us motivated? I also asked myself and my team about this question, because the working condition is so hard, and we work with lots of uncertainty, access issues. But all the time, we got almost the same answer. When we deliver services, the smile of the participant, the changes we are making for the children, for their lives, for their families, that keeps us running for the next day. And as you see, HealthPost runs 6 days a week, 26 days a month, which is a very difficult job. Primary healthcare center runs 24/7, and the only thing actually supports us, that with all the supports we get, we transfer those services to the participants who are entirely depending on our services, on our activities, on the aid. So if we cannot deliver, they will suffer. The refugees, the children will suffer. So this keeps us motivated. From our side, the biggest challenge at this moment, at this particular moment, is like, for the first time, we are worried to have a like underfunded, less than 50% funded joint response plan, and that impacts a lot. The ration card I already mentioned, it was $12 per person per month until February this year, and then it reduced to $10, and from June onward, it will be $8. So when food cut happens, it impacts everything. When funding shortage happens in health, in education, it impacts the life. So we have to adapt our program. We have to increase our communication. We have to increase our efficiencies day by day, week by week. And these adaptations continuously keep us like very much engaged. We need to focus on. Other challenges related to the response is like security issues. Government of Bangladesh is very much working on it. They are in the central position of the response, for coordination, for ensuring security, for make everyone accountable. In the same time, they are also responsible for ensuring security. And Government of Bangladesh has deployed a big security force. But the certain situation like this big population, they are idle. They do not have anything to do. They are not engaged. So when you have a big populations having nothing to do, nothing to keep themselves engaged, they're exposed and very easy target for all the illegal things. And that's actually happening at this moment. For drug trafficking, for extortion, for criminal activities and taking control from one group to another. Every day we see gunfights. Before 5 to 6 months, I used to ask a child or our participant when I visit camps, what is the biggest challenge at this moment? Oftentimes they said the access, the road, lack of playing field, or domestic violence, or abuse, or neglect. They are not. These are the key things that they felt most challenging. But recent times, in last 2-3 months, every child, they are saying in the night they are hearing gunshot. They in the learning when they're in the learning centers, they're afraid of having hearing gunshots, and people are running one place to another. So these are the biggest challenge at this moment. Thank you, Amy.
Thank you. What a frightening addition for children. I know that this is a particular area that is close to your heart too, Rachel, and thank you for waiting so patiently there. But I've got a question for you. Why do you think the global community should continue to care about this crisis, and how can countries like New Zealand help?
Yeah, sure. That's a really good question, and I think our other panelists today have already expressed really, really well why we should care about this crisis. I'm very aware that for the New Zealand public, for a lot of people, it is really hard to absorb this kind of information, and it is overwhelming. It's also really hard to get compassion fatigue on these kind of things, especially when we're looking at a crisis that is so prolonged. We're talking about generations of people living in a really complex situation with no clear answers. And so it's very easy to just go, that's in the too hard basket. I can't deal with that right now. But I think the stories that are coming out from the other panelists really are a great reminder that the lives of people in refugee camps matter. It is our job to make sure they don't get forgotten and it doesn't become a forgotten generation. I think Maheen said it, that over 50% of the people in camps are children, and they should have hope. They should have a future. And it is up to us in the rest of the world to make sure that the rights of children are realized. So I think that alone, the fact that they are people and they are suffering, means that we need to keep paying attention. What can we do as the New Zealand public? We can make sure they don't get forgotten. I'll be honest, I'm quite blown away at the amount of effort that it has been put in and the care that is put in by the New Zealand public and by the New Zealand government in continuing to support this over the years. And I do think it is worth acknowledging the New Zealand government for continually funding projects like the one that we're talking about today. We can thank them as the New Zealand public. We can thank our lovely representatives for keeping this on the agenda, and we can make sure that it stays on the agenda. Within the programs that Save the Children are running, you would have heard that they are health posts of real innovation. Of what I'm saying is this level of disability inclusion that is also going into these projects, because we are quite committed to making sure not only are there access to health services for mums, as you have heard, for people who are ill, but making sure that the exceptionally vulnerable can also get that access is really, really important. So we are really emphasizing that. You would have heard that it is a real issue, and just to put a few stats on it, 12% of people in the camps have the disability. So it's not a small population that we're talking about. But what else can you do? I can understand that people would go, yep, great, we'll keep it on our minds. You can be generous. You can continually fund. There are many programs that are doing really good work in these camps. find one that you're passionate about, that you agree with. You've heard about saves today. Find one and contribute. If you can't contribute, just send a message of support. You're sitting with 3 excellent panelists today who, and I really loved it. I can't remember who said it, but their motivation was the smiles on children's faces. That's amazing. These guys see some pretty hard things day to day. Send an email. Let us know that you are thinking of them, and we will pass that message on to the panelists, and stay informed. I think that is what we can do. We can make sure it's on our radar. We can share it with others. We can continually talk to our government representatives. But if we're not a voice for continually keeping it on the agenda, then it will get lost and we will have a forgotten generation.
Thanks so much, Rachel. Really well said. And obviously today you can also help support this particular health post. And as I mentioned earlier, with that generous government funding comes dollar for dollar matching. So $20 today gets you $40 of funding for this vital project. Speaking of smiles on faces and beautiful stories, we actually have one last short video to share before we get into everyone's questions, which just gives a little taste of some of the people that we are working with.
Hi, this is Dr. Humaira. I have been working with Save the Children since 2020. During this time, I have seen many changes. Initially, the trend of disease was very high, such as upper respiratory tract infection, lower respiratory tract infection, skin disease. Now, this trend decreases gradually. There are some challenges such as limited human resource, so the waiting time of the program participant is being long. I would like to thank New Zealand people to give us the such opportunity to serve the Rohingya people.
বাচ্চা তো বেশি ইস্যু করে বাচ্চা তো ওষুধ করে বা সেটা ছিল তো ভলান্টিয়ার কল এর বলো আমাদের গিয়ে দেখে আমি বুঝাই আর কত নিনে অসুখ হয়ে বেশি কইবা বুঝাইবা সেটা ছিল না ভলান্টিয়ার কল বুঝাইবা তারা আর রেফার দিয়ে সেটা ছিল ডাক্তার হানা জম কই আর ডাক্তার হানা আসলে ডাক্তার বুঝাইবা ডাক্তার আরে ভালো ওষুধ দিয়ে ডালা ওষুধ আর হাওয়ায় আর বাচ্চা কমে বালা খাইয়ে আর তো বেশি আরাম লাগে খুশি লাগে আর মনে বেশি খুশি লাগে আর সেটা ডাক্তার হাওয়ায় আমার বেশি শুকরিয়া জানাই ডাক্তার হানা দাঁড়ে হায় আর শান্তি লাগে আর খুশি আছে আল্লাহ খুশি আল্লাহ আমাদের শান্তি রাখি আমাদের সারা শান্তি রাখি আর দবাত খাই দাদা হাইলে দবাত খাই লাগে আর তো গাম লাগে শান্তি লাগে বেশি সুন্দর খুশি থাকে।
So just a little taste from just last week when the team was collecting a couple of stories. So thank you very much. Now we'll just go into some questions. There was one for you, Dr. Noman, around when you were talking about the heat in the health posts, in the clinics, and they ask if you have any air conditioning or how do you keep cool?
Yeah, thank you so much for that questions. Actually, you know that in the camp settings, we don't have the electricity because from the government, and actually government only permitted the only primary healthcare center who are currently operating 24/7 in a day. Only government permitted the electricity connection to them. But it's, you know, that the air conditioning, even actually sometimes we struggle to manage the solar panel system. You know that the continuous, you know, sometimes we face some difficulties regarding the solar panel issues and others. But what we try to maintain the optimum the solar panels so that actually we can continue our life-saving and the quality services to the vulnerable populations. But you know that in some of we are advocating, what we are from our end, we are advocating since the end of the 2022 to the government people, as I have said earlier, that the medicine and the supplies is the main the fuel for the health service. So this needs to be kept in the good temperature where we can maintain the quality of the medicine. So things are gradually changing. Recently, actually, we are receiving some of the confirmations from the government, and that based on the things that they will certainly approve for the electricity. And once we have the electricity on all the health posts, suddenly we can have some the high fans or the electric or the air conditioning in the system. But I just want to give an example that yes, we have some in our primary healthcare center actually, where actually we have the generator and we have the electrical supplies, where we are maintaining air conditioning system in some of the components, just like we medicine store. We have extended lab service there where we are maintaining the air conditioning, and even in the delivery room where we have the air conditioning system in the most critical zone, where actually we're trying to put the air conditioning to provide the services. But it's true, gradually we are receiving, and the ice is the melting from the government end, and we are receiving some good confirmation. And in recently actually we are under the support from the New Zealand, and we are reconstructing one of the health posts where actually we are very much confident that we will have some of the good electric connections there. And yeah.
Thank you. I've got a question in around the fires. There was some media coverage on the fires in the camps. I think it was earlier this year and last year as well. How do the fires impact your work and the communities around you? And up to anyone to answer this one. Maheen, you're on mute.
Yeah, maybe I can take it. Thank you. So the entire camp actually is built with very flammable materials, as I mentioned, bamboo and tarps. And during the dry season, which we just passing now, from February to April, everything is super dry, and one simple spark actually could cause a big fire. We had a big fire in 2021. We had big fire in last year, and same as this year. So we have seen that before the fires are happening due to accident, like from the cooking stoves, or some small scale accident. But for the first time, we have seen this year, fire actually was the result of arson, deliberate act, and it affects around 10,000 individuals. So having fire is like constant fear, as there is no natural blockage from one set of blocks to another set of blocks. And if there is strong wind, it goes on, and without in this certain condition, no extinguishing or no firefighting actually works. We at facility level, we tried our best to train and to orient our volunteers, our staffs, how to manage loss of risk. What actually significant we have achieved collectively, like this year, the fire happened in March. We had very few casualties, very few injuries. And that was the result of training and significant investment on awareness, but we could not protect the shelters. One of the primary healthcare centers, many learning centers actually, including households, actually were burnt out. But this is a constant fear. We are investing on making awareness so that we can reduce the casualties. But when fire happens, actually, we had a discussion with a group of children who had experienced the trauma and atrocity in Myanmar, and they said that actually this fire reminded them the same experience that they had in Myanmar, and they had to flee. And for a family, they have very few or no belongings, but whenever they face fire, they lost again everything.
Very, very re-traumatizing, I imagine. I was going to, we're almost ready to wrap up, so I'm going to just give you all one last question, actually. And any that we have missed, we will respond to you all separately via email. But in the meantime, the final question to you all is, what would you like to see for the refugees living in Cox's Bazar? It's a big question.
You asked to us, Amy?
I am asking you. You can start, Maheen.
Okay,
I'm asking to all of you.
Okay, so from my side, I see what we always say to the children, to the refugees: keep the hope. Keep the hope, because we don't know when, but definitely it has to be changed. We cannot keep a generation after generation in this way, neglected and living in a camp for years after years. And we tell our staffs, we tell the humanitarian actors, we tell our supporters, same thing, that please support us so that we can keep the hope upright. And we must have to work with them so that they have the confidence, they have necessary skill and education, so that once situation changes, they come back, they go back to their home and they can really start their life with much more better confidence and education.
Thank you. Dr. Noman.
You're muted.
You're on mute, sorry.
Sorry, very sorry. So I would like to echo with Mahim actually. What we say to our beneficiaries, that actually to keep hope and believe on us, and actually we feel from our heart when we see that the children are smiling and the beneficiaries are smiling when they're receiving a very good and quality service. And from our end, we actually try to provide a good service to them as well. But the last word, actually, I want to say that if you see the fund is shrinking, but day by day the population is increasing. So as in the first word said, that actually they're the aid dependent the beneficiaries. If there is no aid, there will be no service, and the life cycle and their life will be very much hampered. So this is very important to make them smile and to continue the crucial and essential services. This is very much needed, that actually we receive funding so that we can continue our crucial and the essential services to them and to make them smile.
Thank you so much. And Dr. Bashanti?
I would like to say that reproductive health right for all. When I say it, I mean it, that I have to adapt, I have to ethical to our program participants, same as all of our healthcare providers, and we have to acknowledge where they are standing, in a condition they are, how they survive and what they demand. So I think that it's a very very tunic term for understand to deliver or to provide our service or care. So that's all it I can say.
Thank you so much. And Rachel, we'll finish with your thoughts on this.
Sure. I would say big picture, I would like to see a solution. I'd like to see a day where these camps aren't needed and we don't have to sit and talk about that. But in the shorter term, I would love to see anti reports from the staff on field that children are realizing their rights, that they are children who are having childhoods that have hope, that have a future, because their rights are being met on a day-to-day basis.
Absolutely. And it's what every child deserves and is owed. So Thank you. Really good reminder. And thank you all for being here tonight. Thank you to everyone who's come along, and thank you so much again to our incredible guests. You've all got hugely busy jobs and lives, and show so much dedication every day, and we're incredibly proud to be having you here tonight, sharing these experiences with us. So well done. There's a message that's just come in actually in the chat saying that you're all real heroes, and I can't imagine how hard their days are. So thank you again. You are real heroes, and we will catch up with you on another time, at another time. Thank you.
Yeah, thank you very much.
Thank you, everyone. Thank you
Thank
so
you.
much. Thank you, New Zealand people. Yeah. Bye.